HY review. The atypicals, the spirochetes, and the mycobacteria, plus a fast pass on bacterial toxins and genetics. These are the bugs that hide from the gram stain and love pattern recognition. Read the vignette, spot the clue, name the bug or its mechanism, and move. 40 questions, 60 minutes. Clock starts now. Which organism is most likely? A 19-year-old military recruit in a crowded barracks has 2 weeks of low-grade fever, headache, and a persistent dry cough. He looks better than his chest x-ray, which shows diffuse patchy infiltrates, far worse than expected. Blood shows cold agglutinins, and the organism has no cell wall. Read the command, identify the organism. Walking pneumonia in a young recruit with cold agglutinins and no cell wall is Mycoplasma. Mycoplasma pneumonia causes atypical walking pneumonia in young adults in close quarters, recruits in dorms. The x-ray looks worse than the patient feels, the cough is dry, and blood may show cold agglutinins, IgM. It has no cell wall. Its membrane contains sterols, so it does not gram stain and grows slowly on eaten agar. The correct answer is C. Streptococcus pneumoniae causes a typical lobar pneumonia with rusty sputum in a sick-looking patient, not this indolent walking pneumonia with cold agglutinins choice, a wrong. Legionella also causes atypical pneumonia, but with high fever, hyponatremia, and diarrhea from a water source, not the cold agglutinins and barracks spread of Mycoplasma choice, B wrong. This is Mycoplasma pneumoniae. Why will beta-lactam antibiotics fail? And what should be used instead? A young man's walking pneumonia is confirmed to be Mycoplasma pneumoniae. A colleague suggests treating him with amoxicillin. Read the command. Why beta-lactams fail and the right drug? No cell wall? Use a macrolide, tetracycline, or fluoroquinolone. Beta-lactams work by blocking cell wall peptidoglycan synthesis, so they are useless against Mycoplasma, which has no cell wall. Effective drugs instead target other steps, a macrolide azithromycin, a tetracycline doxycycline, or a fluoroquinolone. The correct answer is A. Mycoplasma is a bacterium, not a virus, so an antiviral would do nothing. Choice B wrong. The problem is not beta-lactamase or an altered PBP. There is simply no wall for the drug to act on, and vancomycin also targets the wall and would fail. Choice D wrong. Use a macrolide or doxycycline. Which organism is most likely? A sexually active 22-year-old woman has mucopurulent cervicitis and dysuria. Her partner has urethritis. Testing identifies an obligate intracellular organism that does not gram stain well. Untreated, it can cause pelvic inflammatory disease and a reactive arthritis triad. Read the command, identify the organism. Cervicitis and urethritis from an obligate intracellular bug that causes PID and reactive arthritis is chlamydia. Chlamydia trachomatis cerovis DK is the most common bacterial STI, causing urethritis, cervicitis, and PID, and it can trigger reactive arthritis, conjunctivitis, urethritis, and arthritis together. It is an obligate intracellular organism that does not gram stain well, diagnosed by NIAID. The correct answer is E. Neisseria gonorrhea causes a similar urethritis and cervicitis, but is a gram-negative Diplococcus that gram stains and grows on Thea, Martin, and it often co-infects rather than being this poorly staining intracellular organism. Choice, a wrong. Trichomonas causes a frothy discharge with motile protozoa, not the intracellular STI with reactive arthritis described. Choice, B wrong. This is Chlamydia trachomatis. Which Cereval grouping is correct? 3 chlamydial syndromes are described. Chronic conjunctivitis leading to blindness in a developing country, a genital infection in the US, and painful inguinal lymph nodes, buboes, that drain. Read the command, match the serovars. AC trachoma, DK genital, L1, L3, LGV. Chlamydia trachomatis serovar split cleanly. A, B, and C cause trachome, chronic conjunctivitis, and the leading infectious cause of blindness worldwide. D through K cause genital infection and neonatal conjunctivitis or pneumonia. L1, L3 cause LY-granuloma, venereum with painful inguinal buboes. The correct answer is B. Putting genital disease in AC and trachoma in DK reverses the two, the classic distractor, choice A wrong. Assigning LGV to AC and genital to L1, L3 likewise scrambles the scheme, choice C wrong. The correct match is AC trachoma, DK genital, L1, L3, LGV. Which statement is correct? The chlamydial life cycle has two forms. One is small, metabolically inert, and spreads between cells. The other is larger and replicates inside a cytoplasmic inclusion. Read the command. Match the two forms. Elementary body, infectious and extracellular. Reticulate body, replicating and intracellular. Chlamydia alternates between two forms. The elementary body, EB, is the small, metabolically inert infectious particle that enters a new cell, the extracellular form. Inside, it becomes the reticulate body, RB, which replicates within a cytoplasmic occlusion, then reorganizes back into EBs. Memory hook, elementary enters, reticulate replicates. The correct answer is D. Saying the reticulate body is infectious and extracellular reverses the two forms, choice A wrong. The elementary body does not replicate, it is the inert infectious particle, while replication is the reticulate body's job, choice C wrong. EB enters, RB replicates. This dependence makes chlamydia best described as what? A researcher notes that chlamydia must live inside host cells because it cannot make its own ATP. Read the command, what the ATP dependence makes it, an obligate intracellular energy parasite. Chlamydia cannot make its own ATP, so it must steal energy from the host. It is an obligate intracellular energy parasite. That is why it cannot be grown on artificial agar and must be cultured in living cells, and why it forms cytoplasmic inclusions. The correct answer is C. An obligate anaerobe is defined by oxygen intolerance, not by an inability to make ATP, and chlamydia's issue is energy, not oxygen, choice or wrong. A facultative intracellular organism can survive outside cells, but chlamydia cannot because it depends on host ATP, choice D wrong. Chlamydia is an obligate intracellular energy parasite. Which organism is most likely? A bird breeder develops fever, headache, and an atypical pneumonia after cleaning his parrot cages. Read the command. Identify the organism. Atypical pneumonia after parrot exposure is Chlamydophila psittaci. Chlamydophila, P. psittaci causes P. psittacosis, and atypical pneumonia acquired from birds, classically parrots, and other cetaceans. Bird owners, pet shop workers, and poultry handlers are at risk. Like other chlamydia, it is an obligate intracellular organism. Treat with doxycycline. The correct answer is A. Chlamydia trachomatis causes genital, ocular, and neonatal disease. Not a bird, associated pneumonia, choice B, wrong. Coxiella burnetia causes Q fever from livestock and birthing aerosols, not from pet birds, choice C, wrong. This is Chlamydophila psittaci. Which organism is most likely? A child in North Carolina develops high fever, severe headache, and myalgias, followed by a rash that begins on the wrists and ankles and spreads to the palms, soles, and trunk. He was recently bitten by a tick. Read the command. Identify the organism. A rash starting at wrists and ankles moving on to palms and soles after a tick bite is Rocky Mountain spotted fever. Rickettsii causes Rocky Mountain spotted fever. After a tick bite, dermacental fever and headache are followed by a rash that starts on the wrists and ankles and spreads inward to the trunk. including the palms and soles. Despite the name, it is most common in the southern US. It invades endothelium. Treat with doxycycline. The correct answer is E. Rickettsia prowazekii causes epidemic typhus, whose rash starts seen essentially on the trunk and spreads outward while sparing the palms and soles. The opposite pattern choice A wrong. Ehrlichia is tick-borne too, but usually causes fever, without a prominent rash, and shows moruli in monocytes. Choice D wrong. This is Rickettsia. What is the treatment of choice, even in children? A 6-year-old with suspected Rocky Mountain spotted fever is critically ill, and the team must start empiric therapy before serology returns. Read the command. The treatment of choice for rickettsial disease. Doxycycline, even in children. Doxycycline is the treatment of choice for all rickettsial diseases, including RMSF, and it is started empirically on clinical suspicion. Waiting for serology can be fatal. It is used even in young children here, an accepted exception to the usual caution about tetracyclines in kids, because untreated RMSF is deadly. The correct answer is B. Penicillin G and other beta-lactams are ineffective against obligate intracellular rickettsia, which live inside host cells beyond their reach. Choice A wrong. Vancomycin targets gram-positive cell walls and has no role against rickettsia. Choice E wrong. The answer is doxycycline. Which organism and vector are responsible, and what is the recurrence called? During a refugee crisis with crowding and body lice, several people develop high fever, headache, and a rash that starts on the trunk and spreads outward, sparing the palms and soles. Years later, one patient has a milder recurrence. Read the command, the organism, vector, and recurrence name. Laos-borne epidemic typhus prowazekii. Recurrence is Brillzinsa. Rickettsia prowazekii causes epidemic typhus, spread by the body loss in crowded, unhygienic conditions such as war and refugee camps. The rash starts centrally on the trunk and spreads outward, sparing the palms and soles, the reverse of RMSF. A latent organism can reactivate years later as milder Brillzinsa disease. The correct answer is D. Rickettsia typhi causes endemic murine typhus, spread by FLES from rats, not the Laos-borne epidemic form with Brillzinsa recurrence. Choice B wrong. Rickettsia is tick-borne RMSF with a peripheral rash that includes palms and soles. Choice A wrong. This is Rickettsia prowazekii. Which organism is most likely? A patient from the south-central US has fever, headache, and myalgias after a tick bite with no rash. Labs show leukopenia, thrombocytopenia, and elevated transaminases. A blood smear reveals mulberry-like inclusions morula inside monocytes. Read the command, identify the organism. Moruli inside monocytes point to Ehrlichia. Anaplasma sits in granulocytes. EHRL Ischia causes human monocytic EHRL ischiosis, a tick-borne febrile illness usually without a rash, with leukopenia, thrombocytopenia, and elevated liver enzymes. The clue is morally, mulberry-like clusters, inside monocytes. Its cousin, anaplasma, instead infects granulocytes. Treat with doxycycline. The correct answer is E. Anaplasma phagocytophilum causes a very similar picture, but its moruli are in granulocytes neutrophils, not monocytes. Choice A wrong. Rickettsia would produce the classic RMSF rash on the palms and soles, which is absent here. Choice B wrong. Moruli in monocytes point to Ehrlichia. Which organism is most likely, and how did he get it? A slaughterhouse worker develops fever, headache, and an atypical pneumonia with mild hepatitis. He recalls no insect bite, but he was present when livestock gave birth. There is no rash. Read the command, the organism and route. Q fever from inhaled Coxiella. No rash, no vector. Coxiella burnetii causes Q. fever, which stands out among rickettsia organisms because it needs no-arthropod vector and causes no rash. It spreads by inhaling aerosols in spore-like forms from livestock, especially during birthing amniotic fluid, placenta. It presents as atypical pneumonia and/or hepatitis and can progress to chronic endocarditis. The correct answer is C. Brucella comes from human pasteurized dairy and causes undulant fever, not this inhaled no rash pneumonia. Hepatitis picture choice A wrong. Rickettsia rickettsii requires a teak and produces a rash, both absent here. Choice B wrong. This is Coxiella burnetii. Which organism is most likely? A 28-year-old man has a single, firm, painless genital ulcer with a clean base that appeared 3 weeks after unprotected sex. Dark field microscopy of the exudate shows motile spirochetes. Read the command, identify the organism. A painless, clean-based chancre with spirochetes on dark field is primary syphilis. Primary syphilis presents as a single, firm, painless ulcer, the chancre with a clean base, about 3 weeks after exposure. Trypanemma polydum is too thin to gram stain, but is seen as motile spirochetes on dark field microscopy. The chancre heals on its own, but the infection progresses if untreated. The correct answer is A. Haemophilus ducreyi causes chancroid, a painful ulcer with a ragged base. You do cry, the opposite of the painless syphilitic chancre. Choice B wrong. Herpes simplex causes painful group vesicles that ulcerate, not a single painless firm chancre. Choice C wrong. This is Treponema pallidum. What is the stage of syphilis? A few weeks after a painless genital ulcer resolved, a young woman develops a diffuse maculopapular rash that includes the palms and soles, along with wart-like moist gray lesions in the groin condylomata lata and generalized lymphadenopathy. Read the command, the stage. A rash on the palms and soles plus condylomata lata is secondary syphilis. Secondary syphilis is the systemic, disseminated stage, weeks to months after the chancre. Hallmarks are a diffuse maculopapular rash that classically involves the palms and soles, moist wart-like condylomata lata, and generalized lymphadenopathy. It is highly infectious and then fades into a latent phase. The correct answer is B. Primary syphilis is just the localized painless chancre, which has already resolved here. Before this systemic rash, choice A wrong. Tertiary syphilis appears years later with gummas, aortitis, and neurosyphilis, not this early palm and sole rash. Choice D wrong. This is secondary syphilis. Which stage and lesions explain this? A 60-year-old man, untreated for decades, has a shuffling gait with loss of position sense, shooting pains, and pupils that constrict to accommodation but do not react to light. Argyll-Robertson pupils. Imaging shows a widened ascending aorta. Read the command, the stage, and lesions. Tabes dorsalis plus Argyll-Robertson pupils plus aortitis is tertiary syphilis. Tertiary syphilis appears years to decades later. Neurosyphilis includes tabes, dorsalis, degeneration of the dorsal columns causing sensory ataxia and lost proprioception, and the Argyll-Robertson pupil, which accommodates but does not react to light. It also causes aortitis of the ascending aorta, vasa vasorum endarteritis, and gummas. The correct answer is D. Secondary syphilis causes the palm and sole rash and condylomata lata, not this late neurologic and aortic destruction. Choice A wrong. Congenital syphilis causes saber shins and Hutchinson teeth in a child, not decades, later tabes dorsalis in an adult. Choice E wrong. This is tertiary syphilis. What is the diagnosis? A newborn whose mother had untreated syphilis has a persistent runny nose, snuffles, a maculopapular rash, and hepatosplenomegaly. Later he develops notched incisors, a saddle nose, and bowing of the shins. Read the command. The diagnosis: snuffles plus Hutchinson teeth, saddle nose, and saber shins is congenital syphilis. Congenital syphilis follows transplacental spread from an untreated mother. Early signs include eosinophils, infectious nasal discharge, rash, and hepatosplenomegaly. Later stigmata are Hutchinson, notched teeth, a saddle nose, a saber shins, and deafness. It is prevented by treating the mother with penicillin during pregnancy. The correct answer is E. Congenital rubella causes cataracts, a PDA, and deafness, not snuffles, and Hutchinson teeth. Choice B wrong. Congenital toxoplasmosis causes hydrocephalus, intracranial calcifications, and chorioretinitis, a different triad. Choice C wrong. This is congenital syphilis. Which statement is correct? A patient is screened for syphilis, and a resident asks how to interpret non-treponemal versus treponemal tests, given that the screening test can be falsely positive. Read the command, the correct serology statement. Non-treponemal, VDRL, RPR screens, treponemal, FTA, ABS confirms. Syphilis testing is two-tiered. Non-treponemal tests, BDRL, RPR, are cheap, sensitive screens whose titers fall with treatment, but they give falsely positive pregnancy, SLE antiphospholipid, mononucleosis, malaria. A positive screen is confirmed by a specific treponemal test, FDA-ABS, which stays positive for life. The correct answer is C. BDRL and RPR are not confirmatory and do give false positives, which is exactly why a treponemal test is needed. Choice A wrong. Treponemal tests, FTA, ABS stay positive for life and do not revert with cure, so they cannot track treatment response. That is the job of following non-treponemal titers. Choice D wrong. Screen with VDRL, RPR. Confirm with FTA, ABS. What is this reaction? A patient with secondary syphilis is treated with penicillin. Hours later, he develops fever, chills, headache, and myalgias that resolve within a day. Read the command. Name the reaction. Fever hours after treating Spirochetes is Jarisch, Herxheimer. The Jarisch Herxheimer reaction is a flu-like flare. Fever, chills, headache, myalgias, appearing HARS after starting antibiotics penicillin for a Spirochetal infection. It is caused by the sudden killing of Spirochetes, which release pyrogens and endotoxin-like products. It is self-limited and is not an allergy. Treatment is continued. The correct answer is A. A type I IEE penicillin allergy would cause urticaria, bronchospasm, or anaphylaxis, not a self-limited febrile flare from dying organisms. Choice B wrong. Anaphylaxis is an immediate, life-threatening reaction with hypotension and airway compromise, not this transient fever. Choice D wrong. This is the Jarisch-Herxheimer reaction. Which organism and vector are responsible? A hiker in Connecticut develops an expanding red skin lesion with central clearing, a bullseye a week after a small tick bite, along with mild fever and joint aches. Read the command, the organism and vector. A bullseye rash from an Ixodes tick is Lyme disease, Borrelia burgdorferi. Borrelia burgdorferi causes Lyme disease, spread by the Ixodes tick, also the vector for Babesia and Anaplasma. Early localized disease is Erythema migrans, an expanding bullseye rash with central clearing, plus flu-like symptoms. It is concentrated in the northeast, yes, and the tick's reservoir is the white-footed mouse. The correct answer is B. Rickettsia rickettsii is carried by the dermacentric tick and causes a petechial palm and sole rash, not a single bullseye lesion. Choice are wrong. Francisella tularensis comes from rabbits and ticks with an ulcer and adenopathy, not erythema. Migrans. Choice E wrong. This is Borrelia burgdorferi. Which triad of late Lyme features does this represent? An untreated Lyme infection progresses over months. The patient develops episodes of a swollen knee, drooping of the face on both sides, and intermittent lightheadedness. Read the command, the late Lyme triad. Arthritis, plus bilateral facial palsy, plus heart block. disseminated, late Lyme. Disease classically brings arthritis, often a swollen knee, neurologic signs such as bilateral facial Bell's palsy, and carditis with AV block causing lightheadedness. Early or mild disease is treated with doxycycline. Cardiac or CNS involvement warrants IV ceftriaxone. The correct answer is E. Aortitis, gummus, and tabes dorsalis are features of tertiary syphilis, not Lyme disease. Choice A wrong. A rash on the palms and soles points to secondary syphilis or RMSF, not the arthritis. Palsicarditis, triad of Lyme. Choice B wrong. This is late Lyme disease. What explains the relapsing pattern? A patient in a louse-infested camp has recurring bouts of high fever, each lasting a few days and separated by febrile intervals over several weeks. Each relapse coincides with the organism changing its surface proteins. Read the command. Why the fever relapses? Antigenic variation by Borrelia recurrentis. Borrelia recurrentis causes louse-borne relapsing fever. Each febrile bout is cleared as antibodies rise, but the organism then switches its surface proteins, antigenic variation, so it escapes those antibodies and triggers another fever. This cycle repeats until immunity finally catches up. The correct answer is D. The relapses are not from repeated bites. A single infection recurs because the organism keeps changing its coat. Choice A wrong. Borrelia does not form spores. Spore formers are the gram-positive bacillus and Clostridium. Choice B wrong. The mechanism is antigenic variation. Which organism is most likely? A triathlete who swam in a tropical freshwater lake develops high fever, severe muscle aches, especially the calves, and notably red, bloodshot eyes, conjunctival suffusion. A severe case progresses to jaundice, kidney failure, and bleeding. Read the command. Identify the organism. Freshwater exposure, calf myalgias, conjunctival suffusion, and wild disease is Leptospira. Leptospira interrogans causes leptospirosis acquired from water contaminated by animal urine. Surfers, triathletes, and people in the tropics or after floods. Clues are fever, severe calf myalgias, and conjunctival suffusion, red eyes without pus. The severe form, wheel disease, brings jaundice, renal failure, and bleeding. The correct answer is A. Borrelia burgdorferi is tick-borne Lyme disease with erythema migrans, not a waterborne illness with conjunctival suffusion. Choice B wrong. Hepatitis A can cause jaundice, but it lacks the calf myalgias and conjunctival suffusion after freshwater exposure that define leptospirosis. Choice E wrong. This is Leptospira interrogans. Which organism is most likely? A child in a TB endemic country has a mild pneumonia. Chest X-ray shows a small mid-lung lesion with enlarged hilar lymph nodes, AA-GON complex. Sputum shows acid-fast bacilli whose cell wall is rich in mycolic acid. Read the command. Identify the organism. Acid-fast bacilli with a GON complex is M. tuberculosis. Mycobacterium tuberculosis is an acid-fast bacillus whose waxy cell wall is rich in mycolic acid. Primary TB in a child forms a GON complex, a peripheral lung lesion plus enlarged hilar lymph nodes, and is often mild or asymptomatic. It is identified on Ziehl-Neelsen receptor acid-fast staining. The correct answer is C. Streptococcus pneumoniae causes lobar pneumonia and is a gram-positive Diplococcus, not an acid-fast mycolic acid organism. Choice A wrong. Nocardia is partially acid-fast, but is a branching filamentous aerobe causing lung and brain abscesses, not the GON complex of primary TB. Choice D wrong. This is Mycobacterium tuberculosis. What best explains the location and appearance? A 70-year-old with diabetes develops weeks of cough, night sweats, weight loss, and hemoptysis. Chest X-ray shows a cavity in the right upper lobe. Biopsy shows granulomas with central caseous necrosis. Read the command. Explain the apical cavity and caseating granulomas. Reactivation TB favors the high oxygen apex. Reactivation post-primary TB favors the lung apex because the organism is an obligate aerobe and the apex has the Higgs oxygen tension. The immune response walls it off as a caseating central necrosis, granuloma, which can break down and cavitate, releasing bacilli and causing cough, night sweats, weight loss, and hemoptysis. The correct answer is B. Primary TB typically seeds the middle and lower lung zones, gone focus, not the apex favored by reactivation. Choice A wrong. Sarcoidosis forms non-caseating granulomas and does not usually cavitate, unlike the caseating apical disease here. Choice D wrong. This is reactivation, TB. Which immune mechanism explains why blocking TNF-alpha reactivates TB? A patient about to start a TNF-alpha inhibitor for rheumatoid arthritis is screened for latent TB and treated first. Months into therapy, another patient on the same drug reactivates TB. Read the command why anti-TNF reactivates TB. TNF maintains the granuloma Th1-IFN gamma macrophage control. TB is contained by CEL-mediated immunity, THEW unity, THEW-CEAFN, gamma that activates macrophages, and TNF-alpha holds the granuloma together to wall off the organism. Blocking TNF-alpha lets the granuloma break down, so dormant bacilli escape and reactivate. That is why patients are screened and treated for latent TB before starting TNF inhibitors. The correct answer is E. TNF-alpha is central, not irrelevant, to containing TB, so the claim that it does not matter is wrong. Choice A wrong. Choice A wrong. TB is controlled by CEL-mediated daughter-F-daughter immunity, not by antibodies, so antibody depletion is not the mechanism. Choice B wrong. TNF-alpha maintains the granuloma. Which test avoids a false positive from BCG? A nurse who received the BCG vaccine abroad has a positive tuberculin skin test, PPD, but no symptoms. The team wants a test that is not confounded by prior BCG. Read the command, the test unaffected by BCG, the interferon gamma release assay, IGR. Prior BCG vaccination can cause a false positive tuberculin skin test, PPD. The Inter-4 gamma release assay, IGRA, measures IFN, gamma released by the patient's T cells against TB. Specific antigens not present in BCG, so it is not confounded by prior vaccination. Both PPD and IGRA detect exposure, latent or active, not disease activity, by themselves. The correct answer is D. Repeating the PPD runs into the same BCG cross-reaction and stays falsely positive. Choice or wrong. A chest X-ray alone cannot confirm latent TB, which by definition has no active radiographic disease. Choice B wrong. Use an IG array. What are these extrapulmonary forms called? A patient with reactivated TB develops back pain with vertebral destruction and a paraspinal abscess, along with a chronically enlarged matted cervical lymph node. Read the command, name the extrapulmonary forms, pot disease, spine and scrofula, cervical nodes. TB spreads beyond the lung. Spinal TB is potted disease, vertebral destruction with a paraspinal cold abscess, and a possible gibbous deformity. TB cervical LY impetitinus is scrofula, a chronically enlarged matted neck node. Widespread hematogenous seeding produces miliary TB with tiny millet seed nodules. The correct answer is A. A Ghon complex is the primary lung lesion, and miliary TB is disseminated seeding. Neither is the vertebral plus cervical picture named here. Choice B wrong. A gumma and tabes dorsalis are tertiary syphilis lesions, not extrapulmonary TB. Choice C wrong. These are pot disease and scrofula. Which organism is most likely? A man from an endemic region has several hypopigmented skin patches that are numb to touch and a thickened, palpable ulnar nerve. Biopsy shows acid-fast bacilli. The organism cannot be grown in culture and prefers cool body areas. Read the command, identify the organism. Anesthetic hypopigmented patches with nerve thickening and uncultivable acid-fast bacilli is M. leprae. Mycobacterium leprae causes leprosy-Hansen disease. It infects skin and peripheral nerves, giving hypopigmented anesthetic numb patches and thickened palpable nerves. It cannot be grown in culture, prefers cool areas of the body, e.g. skin, nose, extremities, and its animal reservoir is the armadillo. The correct answer is C. Mycobacterium tuberculosis causes pulmonary and systemic disease, not anesthetic skin patches with peripheral nerve thickening. Choice A wrong. Mycobacterium avium complex causes disseminated infection in advanced AIDS, not the classic leprosy skin and nerve picture. Choice B wrong. This is Mycobacterium leprae. What immunologic difference separates these two forms? Two patients have leprosy. One has a few well-defined patches with a strong cell-mediated response and few organisms. The other has widespread nodular skin lesions with a leonine face and abundant bacilli. Read the command, the immunologic difference. Tuberculoid DHD1, possibacillary. Lepromatous DG weak cell, mediated multibacillary. Leprosy runs on a spectrum set by the T-cell response. Tuberculoid leprosy has a strong Leprosy, HND response, so there are few well-defined lesions and FEW organisms, possibacillary, with a better prognosis. The prometheus leprosy has a weak cell-mediated response, D2 shifted, so bacilli multiply widely, diffuse nodular skin, meionofacies, multibacillary, with the worst course. The correct answer is D. The two forms are not immunologically identical. They are defined by opposite T-cell responses. Choice A wrong. The nodular lepromatous form reflects a weak AT2 shifted response, not a strong HEG11. Choice B wrong. Tuberculoid is HEG porcibacillary. Lepromatous is HTG multibacillary. Which organism is most likely, and what prophylaxis is indicated at this CD4 count? A patient with AIDS and a CD4 count of 30 develops persistent fever, night sweats, weight loss, and diarrhea, with blood cultures growing an acid-fast organism. Read the command, the organism and prophylaxis. Disseminated MAC in advanced AIDS, azithromycin prophylaxis when CD4 under 50. Mycobacterium avium complex MAC causes disseminated infection in advanced AIDS, typically when the CD4 count falls below 50, fever, night sweats, weight loss, and diarrhea with acid-fast organisms in blood or marrow. Prophylaxis with azithromycin amacrolide is started once CD4 drops below 50. The correct answer is B. Ma'am, tuberculosis is a concern at any CD4 count and is not the CD4 under 50 disseminated syndrome with macrolide prophylaxis described here. Choice A, wrong. M. Leprae causes leprosy of skin and nerves, not a disseminated bloodstream infection in AIDS. Choice C, wrong. This is Mycobacterium avium complex. Which organism is most likely? An aquarium hobbyist develops a slowly enlarging nodule on the hand and forearm weeks after cleaning his fish tank. Biopsy shows a granuloma with acid-fast bacilli. Read the command, identify the organism. A fish tank granuloma with acid-fast bacilli is Mycobacterium marinum. Mycobacterium marinum causes fish tank or swimming pool granuloma, a slowly enlarging nodular skin lesion on the hands or arms after exposure to aquariums or fresh or salt water. It is an atypical, non-tuberculous mycobacterium, so biopsy shows a granuloma with ACIC-faced bacilli. The correct answer is E. Sporothrix schenckii causes a similar nodular lymphangitis, but from rose thorns in gardening, and it is a dimorphic fungus, not an acid-fast bacillus. Choice, a wrong. Staphylococcus aureus causes acute pyogenic skin infection, not a slow granuloma with acid-fast bacilli. Choice, D, wrong. This is Mycobacterium marinum. In the classic AB toxin, what do the two subunits do? Many bacterial exotoxins have two functional parts. One binds to a host cell receptor, and the other is the enzymatically active portion that damages the cell. Read the command. The roles of A and B. B binds, A is active. In a classic AB exotoxin, the B subunit bends the host cell receptor and delivers the toxin, while the A subunit is the ACTI, enzymatic part that does the damage inside the cell. Simple hook B beans AT active. Diphtheria, cholera, and pertussis toxins all follow this design. The correct answer is A. Saying the A subunit binds and B is active reverses the two roles. Choice B wrong. These are not single subunit toxins. The whole point of the AB design is the division of labor between binding and enzymatic activity. Choice D wrong. B binds, A is active. Which matching is correct? Several exotoxins ultimately raise intracellular camp, but by different routes. One locks the stimulatory G protein on, one disables the inhibitory G protein, and one is itself an adenylate cyclase. Read the command, match the camp mechanisms. Cholera locks GS on, pertussis disables G, anthrax edema factor is an adenylate cyclase. Several toxins converge on Hitch camp by different routes. Cholera toxin permanently activates Gs, locking the stimulatory protein, ON. Pertussis toxin disables G, removing the inhibitory brake. Anthrax edema factor is itself an adenylate cyclase that makes camp directly. ETT's heat label toxin works like cholera. All raise camp, which drives secretion and edema. The correct answer is C. Cholera does not disable G and pertussis does not activate GS. That swaps the two mechanisms. Choice A wrong. These CAM toxins do not inhibit protein synthesis. That is, they separate EF2 ribosome group like diphtheria and Shiga toxin. Choice D wrong. The correct match is cholera, GS on, pertussis G off, anthrax cyclase. Which pairing is correct? Two groups of exotoxins shut down host protein synthesis. One inactivates elongation factor 2, and another cleaves the 60S ribosomal subunits RNA. Read the command, match the protein synthesis inhibitors. Diphtheria and exotoxin. A hit EF2, Shiga hits the 60S rRNA. Two toxin groups halt protein synthesis. Diphtheria toxin and PSC dominans, exotoxin are both ADP ribosylates and inactivate elongation factor 2 EF2. Shiga and Shiga-like toxins instead cleave the 60S ribosomal RNA, stopping translation and also damaging endothelium, which contributes to Hughes. The correct answer is B. Diphtheria and exotoxin act on EF2, not on the 60S subunit, so that assignment is reversed. Choice A wrong. Cholera toxin raises camp and does not touch the ribosome, so it is not a protein synthesis inhibitor. Choice E wrong. EF2 group versus 60S group. Which toxins act by this mechanism? A toxin binds MHC class II and the T-cell receptor outside the normal peptide groove, activating a huge non-specific fraction of T-cells and unleashing a cytokine storm. Read the command which toxins are superantigens. TSST1, staph enterotoxin, and strep pyrogenic exotoxin A. Superantigens bridge MHC class II and the T-cell receptor outside the peptide groove, activating a huge non-specific fraction of T-cells and releasing a flood of IL-1, IL-2, IFN, gamma, and TNF, a cytokine storm causing fever and shock. The classic examples are staphylococcal TSST1, staphylococcal ENT, enterotoxin, food poisoning, and streptococcal pyrogenic exotoxin, A scarlet fever, strep TSS. The correct answer is D. Diphtheria toxin and exotoxin. A inhibit protein synthesis by EF2 and are not superantigens. Choice A wrong. Cholera and pertussis toxins act on G proteins to raise CAMP, a completely different mechanism from superantigen T-cell activation. Choice B, wrong. The superantigens are TSST1, staph enterotoxin, and strep pyrogenic exotoxin A. Which set of toxins is acquired by lysogenic phage conversion? Several important bacterial toxins are encoded not on the bacterial chromosome itself, but on a lysogenic bacterial phage that has integrated into the genome. Read the command. Which toxins are phage encoded? The ABCDEE lysogenic set. Some toxins are carried by a lysogenic bacteriophage that integrates into the bacterial genome, phage conversion. The classic set is the ABCDE mnemonic, Shige. Like toxin, botulinum toxin, cholera toxin, diphtheria toxin, and erythrogenic is streptococcal pyrogenic toxin. Lose the phage and you lose the toxin. The correct answer is E. It is not just cholera. Several toxins share this phage. Encoded origin, captured by the ABCDE mnemonic choice, are wrong. The claim that all toxins are chromosomal is false. These 5 are phage. Derived choice, C, wrong. The phage encoded set is ABCDEE. Which mechanism of genetic exchange is this? A non-encapsulated bacterium takes up naked DNA fragments released from dead encapsulated bacteria in its environment and becomes encapsulated and virulent. Read the command, name the mechanism. Uptake of naked environmental DNA is transformation. Transformation is the uptake of naked DNA from the environment, often from lice bacteria, by a Compton cell, which then expresses the new genes. This is the classic Griffith experiment, in which a harmless pneumococcus became virulent. Naturally competent organisms include S. pneumoniae, Haemophilus influenzae, and Neisseria, the Shin group. The correct answer is A. Conjugation requires direct cell-to-cell contact through a pilus to transfer a plasmid, not uptake of free DNA from the environment. Choice B, wrong. Transduction moves DNA via a bacteriophage vector. Again, not naked environmental DNA choice. C, wrong. This is transformation. Which mechanism is this? A multi-drug resistant bacterium transfers a plasmid carrying resistance genes to a neighboring bacterium through a direct ridge, sex pilus, after physical contact. Read the command, name the mechanism. Plasmid transfer via a sex pilus is conjugation. Conjugation transfers DNA, usually a plasmid, from one bacterium to another through direct contact via a sex pilus. An F plus cell donates the F plasmid to an FMA recipient. When the F factor integrates, an F cell can transfer chromosomal genes. R resistance plasmids spread multi-drug resistance this way. The correct answer is C. Transformation is uptake of free environmental DNA, not a contact-dependent pilus transfer. Choice A, wrong. Generalized transduction moves DNA by a bacteriophage, not through a sex pilus. Choice B, wrong. This is conjugation. Which statement about transduction is correct? A bacteriophage accidentally packages a piece of bacterial DNA and injects it into a new bacterium during infection. Read the command, the correct transduction statement. Generalized packages random DNA, specialized carries genes next to the prophage. Transduction moves bacterial DNA via a bacteriophage. In generalized transduction, a lytic phage mistakenly packages random bits of host DNA and delivers them to a new cell. In specialized transduction, a lysogenic prophage excises imprecisely and carries the adjacent bacterial genes, which is how some toxin genes spread. The correct answer is B. Transduction uses a phage vector, not a sex pilus, which belongs to conjugation. Choice wrong. It is not uptake of naked DNA. That is transformation. Choice C, wrong. Generalized is random. Specialized is prophage. Adjacent. What are these mobile jumping genetic elements called, and why do they matter? A hospital sees rapid spread of multi-drug resistance as mobile DNA segments jump between plasmids and the chromosome, and resistance plasmids pass among different bacterial species. Read the command, name the jumping elements and why they matter. Transposons. They shuttle resistance genes and drive multi-drug resistance. Transposons are mobile jumping DNA segments that move between plasmids and the chromosome. By hopping resistance genes onto R, resistance plasmids, which then spread by conjugation, they let multi-drug resistance disseminate rapidly, even across different bacterial species. This is a major driver of hospital antibiotic resistance. The correct answer is D. Prophages are integrated phage genomes, not the jumping elements that shuttle resistance genes described here. Choice A wrong. Introns are non-coding sequences spliced out during eukaryotic RNA processing, unrelated to bacterial resistance spread. Choice C wrong. These are transposons. That's the block. 40 reps on the bugs that hide from the gram stain, plus toxins and genetics. 60 seconds to lock the patterns. Mycoplasma has no cell wall, so treat with a macrolide or doxycycline, never a beta-lactam. For chlamydia, elementary body enters, reticulate body replicates. RMSF spreads onto the palms and soles, typhus spares them, morula and monocytes mean Ehrlichia and granulocytes, anaplasma. Q fever has no rash and no vector. Syphilis, chancre, then palms and soles, then tabes and aotitis. Screen with VDRL, confirm with FTA, ABS. Lyme's late triad is arthritis, facial palsy, and heart block. Reactivation TB loves the oxygen-rich apex, and TNF holds the granuloma together. Tuberculoid leprosy is a strong H1 response. Lepromatis is weak. MAC hits when CD4 drops below 50. B binds and A is active. Diphtheria and Pseudomonas exotoxin both hit EF2. And DNA moves three ways. Transformation is naked DNA. Conjugation is the pilus. Transduction is the phage. Train process, not memorization. StepLogic. Learn how to think, not memorize. Next up in the micro series, antimicrobials and resistance.